Well, there are always challenges with patients with AMD, but the most important is that they do not have access to very new strategic medications. And it's always a challenge to treat people which are not able to pay actually for this treatment. And this is a big issue in Bulgaria, so we are trying very hard to find support for these people so they can have the equal medication the other people get in Europe. This is our primary goal, and now we have new types of medications which are coming on the market, new anti-VEGF treatments, and it's very nice if we can have them also for our patients, so we can choose from one or two medications and not only one which is the cheapest and not always the best for the patient. You have to treat individually everyone, so to be sure that it really works for him, because it's a special disease and everybody is different in responding to the treatment. Well, there are lots of new things, but I'm very happy that we have this OCT Angio, which is actually made maybe only for the AMD patients, because you can now see actually in wet AMD the developing CNV membranes, which was impossible before, and now you can see the smallest changes in the drusen or in the wet AMD patients, so you can start as early as possible, which is the most important thing in the treatment, to start as early. And also we have these autofluorescence pictures, which are very good for the dry AMD, and they help you prognose whether it will go in further progression or whether it will stop. And this is also very important in order to predict. It gives us the possibility to predict which patients are at greater risk for further worsening of the condition and who are actually on a stable condition, and you can wait more with them and not to hurry up with other technologies. And also we have lasers now coming, which help you very much to start the treatment. Well, there are several trends, but one of the which I like most is the stem cell therapy. It is going on a research for several years, and it's finally coming to a very good results, because they can now have stem cells become photoreceptors, not only retinal pigment epithelial, but together they can cultivate retinal pigment epithelial and photoreceptors. And there are clinics actually who are starting with this treatment. Even in Switzerland, I know that they propose such gene therapy to patients now, and this is a huge, I think, success. This is the way we should probably treat. No one knows AMD, and also these other possibilities with dry AMD, which are connected with the photo modulations of the tissue. When you photomodulate, you work on the mitochondrial dysfunction, and this stops the disease, especially in dry AMD. If you find it early, they show amazing results that you stop drusen formation, and they do not go to geographic atrophy, which is actually a perfect cure. If you can stop it from happening, this is the best. So we have lots of new trends and also new anti-VEGF treatment medications, which are better than the one we had previously. So we have lots of innovation in this disease. But I think also gene therapy, which they are proposing, will finally have a success and very good results. Because if you stop from having the gene in the gene changes, then this will be the best. Then you have to not to fear that you will ever develop AMD.